suppose our last sort of formal session really, I think, is very, very important, and that is making a practical start, and in particular how practice vets or practicing vets can get involved. And again, we have three speakers back to back. We have Dr. Rachel Dean, who is currently Clinical Associate Professor in Feline Medicine at Nottingham. We have Dr. Douglas Grindlay, who's been Veterinary Information Specialist for the Centre of Evidence-Based Medicine at the University of Nottingham since April 2011. And last but not least, we have Clare Boulton, who is the holder of all the information you could possibly want, and is at the RCVS Library. So without further ado, I'm going to hand over. I think you're sitting in the right sequence, aren't you? So it's over to Rachel, first of all. Thank you.
Thanks, Jeff, and thanks, everybody, for lasting this long. After all of the discussion and talks so far today, I'm now a little bit nervous that mine's called Making a Practical Start, because certainly some of the barriers that we've talked about is how do we actually do that? And I think that's possibly why I was given this talk. Yes, I teach students about cats at Nottingham, but my other job is to direct the Centre for Evidence-Based Veterinary Medicine. And, well, 4 years ago, I went for an interview at Nottingham Vet School, not having a clue what Nottingham Vet School was, and I asked a question in my interview, what's this thing about a Centre for Evidence-Based Veterinary Medicine? And they nodded sagely at me thinking, oh, nice question, but I'm not sure we know. But anyway, somehow I got the job, and they gave me the job to direct the Centre for Evidence-Based Veterinary Medicine. And not long after I started, Marnie, who's the Deputy Director, who's over there, I'm going to humiliate quite a few people around the room in the next 5 minutes. Marnie started not long after I did. So 3.5 years ago, we were sitting in the office going, well, we need to make a practical start. What is it that we need to do? What is evidence-based veterinary medicine, and how do we create a centre for evidence-based veterinary medicine? So the first thing we thought we'd do, which was some advice from the med school, was create an identity, which is the logo up here, which I've been told today is a nice flower or a snowflake or a firework. Somebody's already told me before now that it also looks like a cat's bum. So I didn't realise that. I don't know whether that's the feline vet in me just surreptitiously coming in there, but we got ourselves a logo and we got ourselves a strapline. And for a bit of history, and because conflict of interest has been mentioned, how come Nottingham decided they'd have the centre when we first started? We didn't really know what that was going to be. Well, when the vet school started and we had a new research initiative, there's a big push in the medical school at Nottingham for evidence-based stuff, and they have 2 or 3 centres. And somebody on the research panel was saying, well, what do they do in veterinary medicine? And I think everybody said, well, we all do it a bit, and we kind of know what it is, but we don't have a focus for it. So that's how the idea hatched, with the head of the medical school, who's now the current chair of the General Medical Council, and George Gunn, who's the head of animal health for Novartis, were standing in a field going, that sounds like a good idea. So what they did was they partitioned a significant amount of money, which meant the centre was funded, which is, I think, a really important thing, and we've talked about funding. So we work on an unrestricted grant given to us by Novartis Animal Health and the University of Nottingham. So they know what we're doing, but they don't dictate what we do. So 3.5 years ago, Marnie and I sitting around going, oh, pretty logo, what do we need to do? And one thing we did need to do was, she says, messing the slides up, was get ourselves a team. Sally showed you this picture earlier. I've added a few people along the bottom. So there's Marnie and I as the 2 academics working in this team. We've now got 8 PhD students, 4 postdocs, an information specialist. This is our secret weapon, these 2 people here, with one of the great questions over there about bridging the gaps. How do we do this? You need some of these. And we've also got an admin assistant working with us as well. So we've got a great team. So everything I'm going to talk about is their work, really. And they've helped us to develop the ideas that hopefully will help other people think about how we make a practical start. I can't talk about all of the work that they do. The individuals are here. So if you could just start waving if you're one of these people here, so people can identify you. They're branded with the cat bum or the firework, so if in doubt, over a glass of wine, go and talk to somebody in a blue shirt with a firework on them, and I'm sure they'll happily talk to you about what we do. A lot of our work is primarily focused on companion animal practice, but all of the principles goes across whatever aspect of the profession that you work in. And we now have 2 PhD students that we work with Wensler, who was speaking earlier, on the farm, and we're moving towards doing more stuff with the equine group as well. So Sally showed you this some time ago. This morning seemed like a long time ago when at one point it looked like I was doing Sally's talk too, as she was stuck on a train somewhere near Reading, and it's quite nice that I didn't have to do that. But here's a definition that we've developed, and like all of our ideas, we've completely stolen them from the medical field. It's a shame Dr. Khan's not here anymore, because he would probably recognise some of it. But really, evidence-based veterinary medicine is about good vets using good science to make good decisions. So what we have to work on as a team is how good is our science, how much science have we got, how do vets then use that science, so how do they make decisions, and who are they making decisions about? So we split our research up into 4 main areas. One of them is population research. Initially we thought that was all about the animals, but it's actually also about the owners and the vets, because it's those populations that all work together to make these clinical decisions, and what we need to do is work to make them evidence-based. So we've got our population research theme. We do quite a bit of practice-based research, which I'll talk about later. We also do some systematic review, which Doug will talk about. And one of the major things that we do is, people have talked about it a little bit, about how we actually translate the information that we've got and get people to use it. So that's what we do. So our overall aim is to increase the awareness. Thanks to the RCVS Trust, you're helping us no end just by doing today. It's great to see so many people interested. But we're also interested in getting people to use them, because we want to put research into practice, whether that be getting people in practice to do research or getting people in practice using research more. You can interpret that whichever way you like, but that is what we're trying to do. So the first thing we thought we'd set out to do is ask people what they thought. So we surveyed the profession at the time from the RCVS register, and some of you may recognise this. This was a big survey that was sent out with one of those bribey chocolates and pens that were also on your table. We continue to bribe. There's evidence that says that works, okay, for surveys, bribe people. So we sent this out, and we asked lots of different things, including what do you think of evidence-based veterinary medicine? And you get some lovely, heartwarming results that say 82% have heard of it, and 61% want to know more. And you see we've got a fairly good response rate. It's about a third of the profession. And we could just go, well, that's great, 61% of people want us, want to know more, but then you've also got to think, well, what are the other 40% thinking? We want to try and see the early adopters and the people that are going to take an awful lot of convincing. And when you start something new, you also get some things that aren't quite so positive. This didn't make me feel quite so good that day. So the concept of evidence-based medicine is utterly offensive and meaningless. Everything we do is evidence-based. So it's either offensive and meaningless, or you do it all the time. I'm not sure which it is, but that's not going to make you feel too great about yourself on a Monday morning. But we've actually got some really useful results from that. And Torben, who's sitting just here, gives a wave, and Marnie, who's over there, are working on this. So if you've given some data, please feel free to go and talk to them about it. We're in the process of publishing the papers so people can see what we've learned. So, practical start. I've already talked about one of the things that we did was checking out whether people knew what we were talking about and whether they wanted to know more. But some of these things you've seen. So what I'm going to do is break down evidence-based veterinary medicine into 5 steps, give you the opportunity to think about how you can be involved in the 5 steps, but also talk about what we've done. So the first thing you do is ask a question. You then find yourself some evidence. You then look at the evidence and see whether it's any good. Then, if you think it's any good and it's relevant to your patients, you may think about applying it. And I am so relieved I put the word assess, not audit, as point number 5. I think we'll probably go back to this audit, clinical governance, whatever. But what I'm saying in this situation is if you do make a change, or if you do look at the literature and think, or a new clinical trial or a new bit of research and think, I'm going to use that, you need to stand back and think, did it make a difference? That's thorny subject as does evidence-based veterinary medicine make a difference? I think we need to look at that. Most important thing, I think, is you can do all the fancy Cochrane reviews in the world, but unless it actually starts and finishes in practice, it's a total waste of time, and that's the cycle of how it works. So it starts, I think Wendela touched on it before, it starts with a question coming from practitioners saying, this is what I need to know, and that's first of all where people need to get involved. Wherever you are, whether you be in practice or you're a regulator or whatever you do, the question needs to start there. And then some fancy stuff in the middle, like our colleague brought in over here. Maybe we need some help for the acquiring and the appraising, and we've certainly got some great expertise here today. But then we've got to give it back in a usable form if we're really going to make a difference. So you'll see as we talk through it, as a centre, we're getting much more progress with the first 3 things than we are with the second 2 things. But as our work continues, then hopefully we'll learn, as other people in the room are also trying to do, about putting their research into practice. So the first thing really is ask. You've got to ask the right question if you're going to find useful evidence that people are going to use in practice. And I'm a cat vet. cute cat, had to put one in somewhere. And yet again, a posh cute cat with a horrible heart, with a leg that doesn't work. And I know what I'm thinking, is there any point in me doing anything? He's probably thinking, what are my chances? What his owner's thinking is also important, because that affects how we're potentially going to move forward with this case. But I think everybody in the room needs to think about, what do I need to know? Okay, you need to be, we need to start being clearer about that, and a few people have already brought that to the table, that we need to find out what it is we need to know something about. So we thought that's what we need to know, is find out what vets need to know. So we've done quite a bit of research around this, and the questionnaire that Marnie and Torben are dealing with, we actually asked vets to write down in their own little anecdote, all 4,851 of them, what they saw commonly and what they thought the amount of evidence around those species and conditions were. And I'm just going to show you a very basic example of the results. This is a word cloud. If you haven't seen a word cloud before, basically, the more frequently a word is mentioned, the bigger it is. So this potentially would suggest that vets here talked about dogs, cats and rabbits the most, closely followed by guinea pigs, which is almost the same size as a horse, and sheep are sort of slightly less than cattle. So of the people that we surveyed, this is what they were saying. When we asked them about conditions, these three come up, so Aidan will be happy with his skin there, and then we've got some gastrointestinal and musculoskeletal and various other things. Non-specific is really big, and there's lots of different things that are included in there, but if you ask vets about what they see a lot of, this is what they say. At the same time as doing this, we've had two students working with a group of small animal practices, and Natalie, who's over there, wave at me, Nat, Nat had the lovely job of saying, yes, I'll do a PhD for you, Rach, and I said, okay, go off and watch 2,000 small animal consultations and tell me what goes on. She'll never be a normal consulting vet ever again. But basically, what she watched was the whole of the two-way communication, or three-way communication if you include the animal, of what was going on. And she has very similar data. I'm not showing any of her results here, but cats and dogs come in frequently into small animal practice. Rabbits are the next thing, and the things that are frequently talked about are skin, gastrointestinal and musculoskeletal disease, amongst a whole lot of other things. It's not just the primary reason they come in, but all of the things that are discussed. So we're trying to have a go at what questions need answering. So what is your question? What I want to show you just now, and I'm hoping this is going to work, they say you should never work with animals or children. You should also never work with the internet live in front of 160 people who are your peers, but I'm going to give it a bash, okay? Write this down at the moment if you like. It's going to change, but this is a website we're in the process of developing at the centre, and a lot of our work over the last 2 years has gone towards this. And come with me. This is a website that we're in the process of developing. As you can see on the left-hand side as you look at it, this is a promotional website, so it's under development. It will disappear fairly soon, and hopefully in the first quarter of next year the real thing will arrive. We've nicked this idea from the human healthcare field, so if you type in best bets into your browser right now, Google it if you want, if you've got a Palm Top or an iPhone or whatever, you can get onto this website right now, be part of it, do something, make a practical start with your evidence-based veterinary medicine. You can also go and look at the medics one. They developed it for emergency medics. They've got lots of medics on the floor having to make quick decisions. They don't have an awful lot of good quality evidence, just like us, but they still have to make a decision. And their question is, well, what's the best evidence that we've got? And this is what we've started to do for vets. I'm going to go into some examples. So basically, there's 3 example questions there that vets have asked us. These have all come from the real world. And you can see that the bottom one's been mentioned a few times, so I'm going to avoid that one like the plague. But maybe the top one we have, do cows with toxic mastitis need antibiotics? So what a best bet does is start with a question. So if you're on the website, click through to it, and you get to a screen that looks like this. Okay? So we have our original question. Do cows with toxic mastitis need antibiotics? Which is a very generic question. That's actually quite a difficult question to search and get to the nitty-gritty of. So what we put in is a clinical scenario that makes the situation a little bit more specific. So potentially, if a farm vet was reading this, they can recognize this situation. And then what we do is turn it into a PICO question, which is what we've got here. And a PICO question, the P is the first bracket, which means patient or problem. Okay? The IC is the intervention and comparator, which is the second bracket. which is danafloxacin versus nothing in this situation. And the O is the outcomes. This is how you can structure a question that means you can search much more freely and easily. It's still asking a very similar question to the original one, but it makes it far more specific. It might be you have a slightly different question. It might not be about danafloxacin, so maybe you can't use this vet. But what we're doing is we're collecting questions, and that's what we want to do. So we can create a database of these questions that are useful to you. We have about 40 of them at the moment, hopefully that will go live at the end of the year. But one thing you can do right now and over the next few days, it's still going to be open to you, is go to the homepage of Best Bets for Vets, and you see the big purple columns on the right-hand side. Click any of them. Give us some feedback. Have a look around the website, see if it works for you. If you've got a question, click on the question. Register yourself on the internet and you can write a question. It doesn't have to be in the PICO format, but tell us what it is that you're interested in. You can make a start. That's a practical start. Very relieved the internet worked. That's really good. We're back. Okay. What I'm going to do now is move to the second step, and this is definitely not my area of expertise. I'm going to pass on to Doug, who's going to pass on to Claire, to talk about acquiring the evidence. So once you've nailed your question, then how do you successfully search for what you're looking for?
Okay, thank you, Rachel. When I came to the Centre of Evidence-Based Veterinary Medicine a year and a half ago from the human field, I had a lot of questions. I had a lot of experience from what was done in the human evidence-based field, and I very quickly learned that veterinary medicine, there's a lot of parallels, and it's very tempting just to take what they do in human medicine and apply it to veterinary medicine, but there's also a lot of differences, and I think the first 6 months was realising what the differences were. And I very quickly had a list of questions. As an information specialist, I'm very much at the acquire part of the 5 steps of evidence-based medicine, and within about a month or two, we got into one of the basic questions, is which you're searching for the evidence in databases, because that's where you go looking for the evidence. A lot of people here have used PubMed. It's very popular with vets because it's free, quite easy to use. But there's lots of other databases that are usually paid for by universities and aren't accessible to vets. And one of the early questions is, where do we need to go to look for the evidence? So the basic question was, which databases do we need to look at? And I went out and looked at all the different databases that are available. We found 9. Some are specialist, scientific or veterinary, some are more general, covering the whole gamut of research. And what we did, we took 9 databases. I went out and made a very long list of as many veterinary journals as I could find. But what I very quickly learned is that a lot of veterinary research isn't in veterinary journals, it's in generic journals. So we had to widen it. So we had to widen it to animal science, animal production, some medical journals, zoological journals, trying to be as wide as possible. Because one of the things about evidence-based medicine is you don't know where you're going to find the evidence. It's not necessarily in the high quality, high impact factor journals. Sometimes the evidence could be in an obscure journal you've never heard of in Eastern Europe or Asia. And this is one of the things in human medicine they're realizing when they do Cochrane reviews. You'll often find an RCT published in Japan or somewhere that people weren't aware of. And this is one of the important things, going and finding as much of the evidence as you can. So at the end of the day, we had a list of journals which was nearly 1,200. And I then, for months and months, trawled through all the databases trying to find out what was in them. And we compared the journals that we've got in this list with what was in the databases. And what we found was a database called CAB Abstracts was by far the best. It's well known to veterinary librarians. It aims to cover the veterinary literature thoroughly. This isn't, as I say, it's known to librarians. What we've done is quantified it. So CAB Abstracts was giving 90.2% coverage. 2 generic databases, Scopus and Web of Science, just covering about half the journals. But Medline, which is probably the database you're aware of in the form of PubMed, was only giving 36% coverage. So there's a whole load of journals in there that Medline wasn't covering. And 23%, so nearly a quarter of the journals in that list, were unique to CAB Abstracts. So what we concluded from this study was that if you're going to do a comprehensive search, which is a very important part of evidence-based medicine, you need to include CAB Abstracts. And if you don't, you're potentially missing a quarter of the journals and all the research that's in those journals. As I say, it may not be good quality research, but till you've found those papers and critically appraised them, you won't know. And the other quite scary conclusion is if you just search Medline or PubMed, you potentially, and it is potentially, could miss relevant evidence. So why is this important? Well, if you go and look at some of the systematic reviews and other evidence-based resources that are being published, many of them only search PubMed or Medline. Quite a lot of systematic reviews published in refereed journals are only searching Medline. Now, as I say, they may not have missed good evidence, but we don't know. So one of the conclusions is if you're going to do evidence-based searches, you do need to include CAB abstracts. And this will link to something we're going to hear from Clare later. So that's the first question, which we've answered, and it's been published as a paper in the Journal of Veterinary Medical Education. It's still only online, it's not yet in the paper form. There's actually a lot of questions I've been asking, but I'm just going to focus on another question, the second question, which is, we've talked about systematic reviews quite a lot today. We've talked about individual systematic reviews. And coming from the human area, I think one of the questions over there is saying, human evidence-based practitioners don't generally go and search for individual papers. In the human field, there are a lot of resources, databases, where you can find all the information brought together and digested, critically appraised, just as you're saying. And one of those resources is a database called DARE, the Database of Abstract Reviews of Effects. And what DARE does, it's a database of systematic reviews. So it includes the Cochrane reviews that we've been talking about, but in fact there's a lot of other systematic reviews that aren't Cochrane reviews also being published. So I asked myself the same question, coming into evidence-based medicine in the veterinary world, where do we find the systematic reviews and how many are there? And it was a bit of eye-opener what we've found. Just to remind you the definition of a systematic review, this is the Cochrane definition. So it's a review of a clearly formulated question, and it uses systematic and explicit methods, and that's very important, that the methods are stated and they're repeated, so someone else can come along, do the search, and select the material and get the same results, hopefully. As well as the searching, there's also the aspect of critically appraising and how you select and how you analyse the data. So that's what a systematic review is. And as we've heard a couple of times now, good quality systematic reviews are at the top of the pyramid of evidence. So they're a very important resource for veterinary medicine. But as I very quickly found, how do you find these systematic reviews? We can find individual ones if you're in an area like dermatology. In fact, dermatology and veterinary medicine, there's a lot of systematic reviews and they're quite well publicised in the journal. In other areas, it's not so well known where they are. And what we're aiming to do, alongside Best Bets, which is about to go live soon, we're also hoping to do another online database of veterinary systematic reviews. So it's going to be something similar to DARE. So you'll be able to come into this database. You won't be able to access the full text because there's another issue that's been mentioned. They're published in journals, but at least you'll be able to find the reference and the abstract and know that the papers exist. So what I've been doing alongside the work looking at databases, I've been searching PubMed and CAB abstracts using search strategies designed to find systematic reviews. Unfortunately, not all systematic reviews call themselves systematic reviews. I think people are quite reluctant to say they've done a systematic review, so you have to think of all sorts of strange terminology and combinations to find them, just because people don't call themselves systematic reviews necessarily. And our inclusion criteria were that the systematic reviews had to be relevant to veterinary medicine and science, which in itself is very difficult, deciding when is it veterinary or when is it not. There's a lot of research, a lot of systematic reviews on animal models of human disease, which may or not be relevant for veterinary medicine, and that's a difficult decision. There's quite a lot in wild animals, which may or may not be relevant for veterinary medicine. The key thing, we wanted a methods section in the systematic review, and it should name the databases searched. If you don't name where you've been searching, no one else can come along and repeat the search. And this is what I've found. So this is the epidemiology of systematic reviews in veterinary medicine. And you can see around 1990, one or two systematic reviews being published, mainly large animal stuff. And from around 2002, the number of systematic reviews has been going up very rapidly. And as you can see, it's exponential, more or less. Currently, In last year, 2011, just under 200 in total. Up to August, when I've last finished my searches, is 255. The number published each year is increasing linearly, which means an exponential increase in total number. Just to give you some figures, only 2 in 2001, around 41 in 2011. And we're hoping to do a sort of critical appraisal of some of the trends in the quality of these systematic reviews, but there's a big variation in methodological quality. Some, as I've said, just search PubMed alone. Others, like, for example, the systematic review in atopic dermatitis in dogs, searching multiple databases, or the refer guidelines that we talked about, also search multiple databases, which is very important. And some are as good as Cochrane methodology. It tends to be in the areas of zoonoses and public health, where there's probably human medical involvement and there's concern about the human risk. But at the other end, there's some very poor systematic reviews, poor quality search strategies, or not very good selection methodology. And one of the things we've found is there's lots of groups all around the world spontaneously sort of deciding to do systematic reviews. I've got a list of 250 systematic review authors that I've found in these systematic reviews, and they're all over the place: United States, Canada, the UK, Australia, France, and lots of countries of Europe. So in conclusion to my talk, we're hoping to have this online database, and we're hoping it will help you to find the best quality evidence at the top of the pyramid, the systematic reviews. In doing this and finding all these systematic reviews, we think there is potential for a network of systematic review authors, possibly consensus standards, sharing practice, because it's happening, people are doing it anyway, and there is probably a need to try to improve the standard. So it could be an alternative to having a Cochrane-type collaboration, where the systematic reviews are done centrally. It may just be necessary to get the people doing systematic reviews together and try to have common standards. So that's the end of my part. Now we're going to have a second part on acquiring evidence, and I'm going to hand over to Clare.
Hello, everybody. What I'm going to do now is look at where you can actually acquire the evidence. We've heard quite a bit from people in the room about the potential difficulties of accessing published data. So that's my main point. Where can practitioners acquire the evidence? You'll forgive me, I'm the librarian at the Trust, so I'm going to start with the Trust Library. What I should start with saying is that the Trust Library is for practitioners. That's what it was set up to do. In 1856, that was the sole intention of having a library within the college, was for practitioners. And I should also say it's for vet nurses as much as for vets. Okay, we offer a wide range of resources and services. I'll explain a little bit more about those in a moment. And for regular users, we have a membership scheme which has added benefits, the main one of which is access to the electronic access to the data. Okay, Doug has mentioned the importance of CAB abstracts. As far as I'm aware, we are the only library outside the vet schools that have CAB abstracts. That's an important thing to remember. It's on-site only, but we do offer off-site to members a VetMed resource. I've put the full explanation of it there. Effectively, it's the veterinary science database of CAB abstracts. It's got, I'm going to read some numbers out here, 3,000 veterinary and bioscience journals. At the moment, there's 1 million abstracts on it. It's growing by between 40 and 50,000 abstracts a year. It also includes the full text of 14,000 journals and conference proceedings. A lot of those things are the things that Doug was just referring to, the more obscure journals. Just because they're obscure, as Doug said, doesn't mean that they don't contain important, valuable evidence. And CABI have made a concerted effort to go out there and make access available through VetMed resource. Doug mentioned the comparison between CAB abstracts and PubMed. I did a quick search on VetMed resource, so the veterinary subset of CAB abstracts. there was just over 3,000 references to blue tongue, did the same thing on PubMed, and there was half that amount. Again, I'm not saying quantity equals quality, but as we've heard before, we don't know until we've actually looked at that evidence. Okay. As a library, we also have an extensive journal collection. You can see the numbers there. We have a policy of trying to have electronic access if at all possible. That's not always possible. Some publishers will not license us to have off-site electronic access, but we're on just over 500 full-text electronic journals which are available, as I say, off-site to library members. Electronic journals, not just veterinary and animal sciences, but because of the way journals are sold as bundles, we've got quite a few human medicine there. There is a list called the Basic List of Veterinary Medical Serials, and we have access to about 85% of the journals on that list. So, okay. So those previous slides were about our resources. What services do we offer? As a library, we've got myself and other qualified professional library staff, and our key role is to make people who use our resources make the best of them. One of the main things we do to do that is to offer workshops on how to search databases. So how to compile the search strategies that Doug was talking about. You need to think about different terminologies, even plurals. And some searches, cats can make a difference, cat feline, those sort of things. So we're offering workshops, free workshops on how to do that. Either people can come into the library and we'll do it on site, or we can do them online. So people log into us and we'll take you through those searches. We tend to focus on the databases we offer, but we could do, I'm looking at May, because May mainly does them. We can teach people how to use PubMed. If that's what you've got access to, you're not a library member, then we'll show you how to make the best of PubMed. Accepting that you're all busy people, and time, again, is an issue we've heard quite a lot about. If you haven't got time to do it, then tell us what you need and we'll do a search for you. Yeah. So we do tailor-made searches. We can do quarterly alerts, so if you just want to know what's been published in the last 4 months on canine dermatology, then we'll set up a search and it'll run for you. Focused very quickly there on what the Trust Library has to offer. Where else can practitioners find evidence? We had a survey earlier this year in May, and we didn't bribe people, from what I remember. So, and we asked the question, you use the library, where else do you use? And these are the responses we got. I don't think there's anything on there that will surprise you. People pay for membership of associations. Part of the reason they do that is because you'll get access to the journals. And I mentioned before that sometimes we can't provide electronic access. More often than not, it's because the journal is the journal of a membership organisation. So there are restrictions with publishers and licenses and what they'll allow us to have, because obviously they want the membership. I should also say as well, as having journals, some associations, BSAVA, offer access to VetMed resource as well as part of their membership package as a loyalty bonus. So there are two places to get access to VetMed. Other people mentioned individual subscriptions to journals or databases. Fair enough. Some people mentioned, and it's not on the slide, that they just buy what they want when they want it. So if they need this particular article, they pay for access there and then. I have to say, that doesn't make any economic sense to me. Anybody who's done that will know you're talking £25, £30 per download. Critically appraised topics. Brennan mentioned the Banfield ones. There are others out there. Again, people mentioned those. And then a whole category of other resources. I haven't put Google on there. General Google searches appeared quite often in this survey. Things people mentioned, WikiVet, which I'm sure most people in the room know, IVIS, the International Veterinary Information Service, which has conference proceedings, particularly North American conference proceedings, and Veterinary Information Network. Okay, so that's a quick summary of what the Trust Library does, and a quick ramp through other sources of information. I should say, if you're not aware of what the Trust Library does, have a look at our website. Check out what we've got. If you want to try out what we've got, there's a trial membership offer. Often, if you see what's available, it might make you think that access to information isn't perhaps as difficult as it seems. I certainly hope so. I'm now going to hand back to Rachel, who's going to do the third part of acquiring the evidence.
Thanks, Claire, and thanks, Doug. They are our hidden weapons, and I think we need to use them more. Okay, I'm just going to keep going through. We started a little bit late, but I'll move through the last steps. But one thing we found when we've been trying to acquire evidence, and acquiring Douglas was very helpful because it made us realise the best way of searching, and that's some of the methods that we use for best bets. But it also made us realise as we search for best bets and other systematic reviews we're doing that there are gaps in the evidence. Sally asked a question earlier about the practical things we need to do to help move us forward with evidence-based veterinary medicine and practice-based research was one of the things that at least I think 40% of you voted for was a good thing. So that's why one of the arms of the centre was to start working with first opinion practitioners to see how we do this. There are other groups in the room that already do this. Vet Compass are here, which is to do with the venom coding. SAVSNet are here. AHVLA, if that's the right version of the words, are also here. There's quite a few groups that you can get involved with as a practitioner because your data is so valuable. Because what you do is what normal vets do every day, and we need to know about that if we want to do evidence-based veterinary medicine. What we've done at the centre is start to gather a network of sentinel practices. So these are our beacons of information. We're not after large numbers of practices in a similar way to SAVSNet or Vet Compass. We're not doing surveillance. We're starting to work with practitioners to support practitioners in doing research and trying to get their buy-in to the centre. Over a period of time, what we need is 20 to 30 practices. So when we find a gap in the evidence, and we do need to know the best way of treating hotspots, if that's what vets want to know, we have 30 small animal practices that can do that. If we do want to know whether chucking antibiotics into the abdomen of a cow after a seizure actually does anything, we need a network of real-life large animal practices that are doing that. So that's where we're going. At Nottingham as well, as I say, most of our practices are small animal, but some of them are mixed. Sarah, who's here, and Layla, I can't see you. She's there. They've just started a practice-based research project to do with equine colic. They'll grab you afterwards if you're remotely interested. And we've also got some randomised controlled trials of lameness going on in farms at the moment, working with farm animal vets. And I'm sure there's other researchers in the room that are trying to do this kind of research to make it more useful in practice, because we've got to fill the gaps. We can stop and acquire the evidence as much as we like in the more traditional format of EBM, but if we don't do anything new, we're still going to have an awful lot of unknowns, and that involves everybody within the profession. Okay, we could go on forever about practice-based research, but I've managed to stop myself doing that, but please do speak to members of our team if you're interested in being involved in some of what we do. The next step is appraising evidence, and this is a really important part of it, and I like to call it appraising sometimes as opposed to critical appraisal, but critical can be a negative word, but appraising can be a good word. So this doesn't have to be seen as slamming every paper to show how awful it is. It's looking for the good stuff too. And when we teach our students this in final year, we often use the press. And we get our students to read the same story in 4 different newspapers, and then they have a great big argument about what the actual truth is. And potentially we need to look on the scientific literature in a similar way. Different publications, I'm going to show some of them here, and I think they're represented here, but we have lots of different publications, EVJ and JSAP, and lots of different people are here. But these publications are published for lots of different reasons. It's not just the editorial board that's involved, there's the authors and the reviewers have a responsibility for what goes into our literature. We then have a responsibility of what do we do with what we're reading, and how well do we read it. Now, Evidence quality, people have talked about this a lot, and somebody was talking about how do we measure that and deal with it in a systematic review. There is a science and an art of systematic review and critical appraisal, but as an individual, whether you be reading a best bet or whether you be reading a dermatology systematic review or a randomized controlled trial about worms and colic or something, you still have a responsibility to the reader to think, is this any good? Is it relevant to my world? What am I going to do with this? And we all know in the literature there's many shades of grey, okay? This is a rubbish book. I've critically appraised it and it's rubbish. But you kind of have to get into the nitty-gritty if you're going to understand whether something's any good or not. And in the big survey that we were talking about, one of the things we did was ask people what they read, where they read it, and if they did read a scientific study, which bits did they read? And 75% of people read the abstract, and 72% read the conclusion, okay? So that's like reading a histopathology report. Yeah, it's my animal. Ooh, what's wrong with it? And read to the bottom, okay? What you do is you miss the meaty bit in the middle, all right? 25% of people tick that they read the methods, okay? So that's nitty-gritty of how they got the results, and 39% of people actually read the results, okay? There's quite a lot of work in the human field that shows abstracts lie. I think there's something between 18 to 36% of abstracts are truthful in the medical literature. Hopefully that's improving because that's quite an old study now. I don't know what the truth is in the veterinary literature, but by developing best bets, working with Doug on his systematic review database, we certainly realised that if you limit yourself to the abstract and the conclusion, whilst that's quick, you might actually be spending your limited valuable time on the wrong bit. There are some good resources. This is one of my favourite books. And my team are teasing me because it's also one of their favourite books now, partly because it's pink and small. Pink because it's pretty small, you've got time to read it, okay? It's called The Pocket Guide to Critical Appraisal, and it's the one on the right as you look at it here. And basically, yeah, everybody write that down, lots of people start writing, okay? I'll wander around with it afterwards. It's my visual aid, this is one of my practical tips. This is quite an easy book to read, as is Trisha Greenhow's How to Read a Paper. And basically what it does is it gives you some basic questions that when you're reading various different types of study, what you need to ask yourself. We will do some of this for you when we do best bets and we synthesize other evidence, but sometimes you need to do it yourself. And the questions don't have to be tricky. If you look at the standard questions, the first one is, are the aims clearly stated? Okay? That's a yes-no question, hopefully a no-brainer, but you'll be surprised the number of papers you read that you get halfway through the discussion and you still don't know what they set out to do. If they don't know what they want to do, how the hell are you going to believe their conclusion? Okay? Then there's other things like, was the sample size justified? That's slightly statsy speak for saying did they have enough animals or bits of heart or whatever to prove what they set out to prove. So there are some easy things that you can start to learn. What you can then do with that, and I'm just going for it now because it worked last time, is you can start to learn, and what you start to do is get quite quick at reading the literature, because you start to look for the important bits which tend to sit in the methods. So if we go back to this best bet, if you want to have a cruise through it in your own time, if you have a look in the summary table of evidence, what we've got here is we've critically appraised this study. And on the right-hand side, as you look at it, we've got study weaknesses. And what we're doing is we're saying there's the key results, that's in the column on the one but right, and here are the study weaknesses. So this is what they found. These are the numbers. 9 out of 10 cats prefer whiskers. The weaknesses are about in the way they found that result, can you trust it or not? And if you start to look at a variety of bets, the weaknesses become quite consistent. So quite quickly you can get used to looking for the things that are good or bad about a study without weighing yourself down. We'll do this for you in best bets and various other things we do, but it's a skill that you can quite quickly learn that will practically help you with your evidence-based stuff. Nearly at the end there, the next bit is apply, and as you'll see, we're working through these steps ourselves as a centre, and this is one of the trickiest aspects, but it's one of the most important. You've got to put it back in practice if it's going to make any difference whatsoever, otherwise we're all wasting our time. Applying the evidence can be tricky. The first thing you need to do is make people aware of it. And this is not easy because we don't know at the moment how information transfuses across our profession. I've been to some very interesting courses where they've tried to work out how it happens in the medical profession. It's not just because the equivalent, the RCVS, said you must do it that way and everybody goes off and does it. It doesn't work. Just because you write a nice guideline, it doesn't mean everybody does it that way. Often what they find is there's local individuals that everybody listens to and information diffuses better that way than any other way. And what we've got to try and work out is how that happens if we want to spread the evidence through our profession. We asked vets, and you can see that the 4,800 that started were waning a little bit by this stage, but we asked them, if we found something new and exciting, how would you like to find out about it? And this is just some of the results, but it was very split. So if we are going to translate our evidence and give it out to the people that can use it, we probably need to use multiple different sources. What we're doing at the moment with Nat's work and Julie's work, who are our two first PhD students, is going back to the practices and saying, look, this is what we found, what do you think? Where do you think we should go next with this? Because we found loads of stuff and we've given you lots of pizza, now tell us what you think. Because we need to know which lines to follow. We found out an awful lot of things, but which are the most important? And actually, how would you use this in your decision-making process? And what kind of questions have you got? Is it about treatment? Is it about prevalence disease? Is it about diagnostic tests? Dr. Khan showed this, and I changed the title from evidence leakage to veterinary leakage. I think we need to work out where our leakage is, okay, which sounds a little bit disgusting, we're all vets, so it doesn't matter. But there's this thing called the evidence pipeline that they talk about in the human field, and we've definitely got one, even if we're not aware of it. So the first thing you do with a bit of science is say, do people know what's going on, okay? So people know what's going on, then a smaller proportion of people will agree with it, okay? There's no way you're going to do anything unless you agree with the finding. Then you might actually choose to apply it in practice. And the trickiest bit is whether you then stick to that change. And this is well described in the human field. And we haven't even gone there yet. We're going to start to, as we move forward with some of our findings, see whether vets actually find best bets useful and whether it does alter their practice guideline or protocol or whatever. But at each step, knowledge is leaking out, which means all of the people that have done the research, including the practices involved, have maybe wasted their time. So we need to understand some of this. Some people really don't like us. Some people here probably right now really don't like me, sorry. But when you talk about something different, common men hate a new idea, and I should think you can say women as well, and I suppose more or less to ill-treat the original man who brings it. And I think the people, those individual people that can get this evidence through practice or through people that are making policies about our profession, they probably aren't very well liked to start off with, but they're the kind of people that we need to be supporting. Okay, so finally we're to assess. I'm not really going to go anywhere here. There's already been lots of discussion, which I hope will continue, about governance and audit and what those differences are. But I think we need to be trying to look at what we believe best practice to be, and that's fairly poorly defined. But there's a lot of groups working towards that to try and work out where we're going with our clients and what might be best for one animal individual. Herd of cows might be different for another one, but we've got to look at the effects of what we do. So we've got to start measuring outcomes, and then we've got to see how outcomes change if we make a change. I'm just going to finish off with this slide that Sally gave. And she asked earlier, whose responsibility is EBVM? She left it as an open question. I don't believe we had a vote on that one. I'm just going to add one other group, which is the pharmaceutical industry, or veterinary industry per se. I'm just going to give you some ideas of where maybe you can practically start. Can you put your hands up if you see yourself as, if you would call yourself a veterinary practitioner? Doesn't matter what anybody else would call you? Excellent. Okay. Basically, you've got the power, okay? You're the person there making the decisions, whether you're making it on a farm like James is here across a load of cows, or you're standing in your consulting room, you really do have the power. You can decide whether you want to use the evidence, you can choose whether you go to the Best Bets website and actually partake, but you're here, so obviously you are here for a reason, whether you love it or hate it. But I really think you are in the driving seat here potentially. And what I would say is get stuck in, really. If you're asked to be in a practice-based study of some type, go for it. If it interests you and it's relevant, and actually the research question they're asking is relevant, and also if they're going to tell you the results. I hear a few vets say, oh yeah, I got involved in that trial and I never heard anything. And yes, it takes time to get the results out there in the published literature, but if they're never going to publish, why are you wasting your time, and why are you wasting your clients' time and the patients that you treat to be involved? You've got to see where you're going to move forward if you're going to be involved, because you're really valuable. You don't have much time, but if a lot of us spend a little time and what we find out is published, and it doesn't have to be the most perfect trial in the world. There's things called pragmatic trials, which I think we need to do an awful lot more of in veterinary medicine, that aren't perfect, but they give us an answer, which is great. teaching. This was covered a bit by the lovely question from our fifth year from Bristol about what do you do as a student and what should we be doing as teachers. It's great to see so many people in the room, and I think evidence-based veterinary medicine is creeping into curriculums everywhere. And I agree with what Wendela said. I think we need to be challenged by our students, whether it's because they're on EMS or we're teaching them in some learned academic institute. But I think as teachers we need to think, am I being eminent or am I being evidenced here? And also the power of I don't know. We use Best Bets for teaching our fifth years, and John, who leads the farm animal rotation that we teach it on, he loves the fact that they come back all of a quiver because they don't know the answer anymore. And vet students don't really like that because they're black and white, but at least it starts to give that level of uncertainty. And until we admit we're uncertain, we're never going to find out what we need to find out. Researchers, this could go forever, but some things that we've found as we've gone through is you need enough numbers to be sure that the difference is true, okay? Many of the trials that we've looked at for Best Bets and other things is there aren't enough animals there. So when they've got a finding and they've got a beautiful p-value, if you care what a p-value is, but it didn't involve enough animals. So is the finding true? So what's a vet to do? And you'll see that in some of the clinical bottom lines of a Best Bet, which is the very last bit, that once our team have been through the evidence, critically appraised it, they're just saying what they think. You might disagree, and that's absolutely fine. The authors might disagree as well. But they've gone through a set process, critically appraising it, getting to the bottom line. But one problem is not enough numbers. There's lots of chat about impact. When I talk about impact in terms of research, what is what you're doing affecting the clinical decision-making of people within our profession? This applies to basic research all the way to very clinically applied research. But you need a hard hit with your research, and we should be trying to make a difference and move things forward. Veterinary organisations is a bit scary when you're at an RCVS event and you've got the big microphone at the moment and you're a bit like me and sometimes say things you shouldn't. But we've got a lot of veterinary organisations here. And obviously one of them decided to run this day, which is fantastic. And I've no idea how these decisions are made, which it says, if you can't read it, okay, all those in favour of delegating decision-making, shrug your shoulders. I'm not saying that is how decisions are made, but sometimes we do all sit around a table until the person with the most energy and mind space and biggest, loudest voice gets their voice heard. Is that the way that we should be making decisions? But we need regulators, we need guidelines, we need help with some of this. And sometimes there's an awful lot of stuff, and we can't deal with that, okay? Can you come back with that 3-year study summarised in 6 bullet points? Yes, we need something that's useful at the end of it. So you can do a lot of big fancy systematic reviews, and at the end it says, sorry, we've got no evidence. And that's no good if you've got a dying animal in front of you. But we need it in a synthesised form, which is why we're giving Best Bets a bash. Tell us what you think. Access is really important. These two have mentioned it. If you are a regulator or part of a veterinary organisation, potentially you have the power to give people more access to evidence. We can't do that. We're bound by copyright at the university. We can give you the synthesised form, but you can't all email me tomorrow and I give you a PDF of your favourite article. Maybe veterinary organisations can help. Veterinary publications. If you can't read what it says at the bottom, it says, disclaimer, full story may or may not include the full story, and selective biases and other manipulative methods may be used in order to get you to think what we want you to think. I think this has been mentioned a lot. What goes into the press is about the publication themselves, the editors, the reviewers, and the authors. We have reporting guidelines. Doug is writing up a study at the moment where we've asked veterinary editors if they know about about reporting guidelines. So this is the method by which you write up a study, and only about half of the people that responded didn't even know what it was. So if you are involved in writing, reviewing, or editing papers, go and have a look at the Equator Network, which is something that tells you all about reporting guidelines. Industry, let's not learn from their mistakes. If you're here from industry and you haven't read this book yet, get it from W.H. Smith at the station on the way home. Ben Goldacre loves to rant. He's a doctor that talks about the use of science a lot. If you've not read Bad Science, read Bad Science. There's a practical start. But Bad Pharma is about this level of mistrust between the medical profession and the pharmaceutical industry. We don't want to end up there. I don't think we have that at the moment. And as I said at the beginning, we have some funding that's come altruistically from industry, and I think to achieve some of these things, we need to maintain that relationship. Equally, if you do trials in industry and you are using patients, clients, and vets, they deserve to get your results, whatever the results are. So I said a practical start. I don't know whether it's helped. We've definitely made a practical start. There's lots of people from the centre who represent a lot of this work, not me. So there are some new resources and evidence coming your way, and I think today is a very positive move towards that. So I just need to thank the Centre for Evidence-Based Veterinary Medicine, colleagues at the University of Nottingham, Novartis Animal Health and the RCVS Charitable Trust. And what I would say is, whoever you are, whatever you do within the profession, I think you probably have a role, in my opinion, of starting to move this forward. And I think the future's pretty bright at the moment. Thank you very much.